spine is important because it protects the spinal cord and the nerves. Just as we have the skull protecting the brain, God has designed the spine, and people call it the bones of the back, to protect the spinal cord, which contains all the nerves, and protect the nerves as they travel down the neck, through the back, and to the lower back, to the muscles in the body. The more common cause of a spine problem is wear and tear. We call it degenerative arthritis. So the rubbing together of the bones as we're going about our day-to-day activities will lead to degeneration of the spine. Accidents, of course, certainly can, you can have a broken bone and damage your spine. That happens a lot, with road traffic accidents. Then we have patients or people who unfortunately suffer tumors, breast cancer, prostate cancer, and other cancers like multiple myeloma, which is a cancer of the blood, can go to the bone and destroy the bone and lead to bone or spine problems. Then we have people with infection. Infection is particularly important in our environment, and the key infection, of course, is tuberculosis. Tuberculosis can affect and damage bones, and unfortunately it also happens in quite young people. So when we get a child who is complaining of bone pains, you need to check them out properly to make sure they don't have infection with tuberculosis. When you get an elderly person complaining of bone pains, we need to be careful to make sure it's not cancer. Limit your exposure to injuries, falls, road traffic accidents, all those things that are preventable. Then by all means prevent problems with the spine. Sitting position, lying position, the way we walk. I suppose the most important thing is to actually listen to your body. If there's a way you're sitting that is now causing aches and pains, then you know that is wrong for you. So I don't think there's a way, or we can prescribe that everybody should sit in a particular, because our general physique and habitus is different from everyone. And if you're sitting for a long period, then you need to get up and take a walk. If you are sitting in a position that hurts your back, you need to change. Things about orthopedic beds, if it's of importance to you and it helps, fine. Not everybody needs an orthopedic bed. There are actually beds that are maybe better, as far as I'm concerned. They're called memory beds. They remember who's laid on it, in the sense that if you lie on it, it conforms to the shape of your own body. And once you leave, it goes back to its normal position. Then somebody else comes and it conforms to the shape of their own particular body. So that kind of bed perhaps is more important because it's tailored to each individual that's lying on it. The most important thing, I suppose, is don't smoke. Smoking is bad for everybody, and it's especially bad for the spine. We as doctors don't like smokers. We don't especially like operating on people who smoke because their wounds don't heal very well. And for spine surgery especially, it can be a disaster. Finally, of course, if you're seeing a specialist, a physiotherapist or a chiropractor, or any of those people who massage the spine, if the massage is causing pain, they're doing harm. You need to stop.